We rely on our hands and our wrists for virtually every activity. But if you are experiencing pain in daily life, what are you going to do about it? Actually, you don't have to live with it, even though many of us do. Joining me now is Dr. Andrew Nelson. He's an orthopedic surgeon with Starling Physicians. Thank you for being with us.
Good morning. Thank you.
So are hand and wrist injuries really common?
They are. A lot of people think that hand and wrist injuries don't happen that often, but they're really in everybody you talk to if you ask them.
Yeah, and I know that a lot of athletes or even workers will just kind of deal with it. I'll even hear people in the newsroom, oh, I've got carpal tunnel, oh, I've got this. And we kind of just keep living that way and not seeking treatment. Is it wrong to wait?
I think it's human nature to think that it's going to go away tomorrow, but if it's something that stays with you for a couple of days in a row, I think it's worth getting some good advice.
And so what, for people listening on the Facebook Live, like what kind of pain are we talking about? And then what do you do about it?
Well, there's things that happen just on their own, and then there are things that happen because of an injury or a fall. For instance, one of the most common things that is talked about and even confused is carpal tunnel syndrome. So carpal tunnel syndrome is numbness and tingling into the fingers. And classically, it involves people at nighttime. So it can wake them out of their sleep or be annoying in the morning. And if it gets worse, it starts to travel into their daytime activities, which include driving or typing or doing their hair or yard work. For most people, it's not really a painful thing. However, in about 20% of people, it really is painful. And people describe that as their number one thing that they want to get rid of is the pain of it. So if that's going on, that's worthy of a conversation with somebody like myself as a hand surgeon.
Yeah, and it's not always surgery, right? What might you do for someone who's experiencing that?
Yeah, exactly. So I kind of categorize people into two groups: those people who have symptoms or numbness and tingling that comes and goes, and then those who have it constantly. The people who have it constantly probably waited too long, and they really need to have surgery, in my opinion. For those people who catch a little bit earlier, or if they're lucky where they don't have it constantly, there absolutely are steps. So the very first step is to wear a brace at nighttime. And the kind of brace that we're talking about is a carpal tunnel brace that has a hard piece on the bottom. And what it does is it prevents you from sleeping with your wrists tucked in. A friend of mine called that sleeping with a kind of a dog pose or puppy paws.
Okay.
So if you keep your wrist straight, then you can avoid having that nighttime numbness or morning numbness. And for a good chunk of people, that's all that you need. Take a brace that you can buy at the drugstore, or we can provide you in the office, and try that. So that's my very first step. The next step would be consideration of a steroid injection. And there's a bit of controversy in that. And by that, I mean, I think all of us who do this for a living know that steroid injections will not last forever, but they can buy you some time. And if you have ongoing symptoms that haven't gotten better with a splint or an injection, or they're really bad, then surgery can be performed, which luckily is very small these days.
And there are some overuse injuries that can cause this extreme pain. You mentioned carpal tunnel syndrome. Maybe if we don't have it yet, or we're just in the beginning stages, what should we not do so we don't end up with a big problem like carpal tunnel or trigger finger?
Well, if you are doing something, for instance, on a factory line, that's one thing. But if you're doing your regular activities, I think just staying healthy and exercising is the best thing to do. Often you can't avoid it. So I think your question is there anything we can do to make this not happen? And there really isn't. I guess the best word is to do things in moderation. So
Okay.
for some people, for instance, they go into the garden and they're passionate about it, and they may spend 6, 8, or 10 hours all day long pulling weeds and things. And as our bodies change, you just can't handle that. So I tell people to break up their tasks into little bits. So if you have a couple hours of gardening, do a little bit in the morning, do a little bit in the afternoon, and then it's not all one brunt onto your body.
And if you've been dealing with this, I know you said early detection is kind of key, because you don't want to end up being the person who's been really having this chronic pain for a long time and maybe the only option is surgery. So if you're feeling this, is the first step to go to someone like you at Starling Physicians and get a consultation?
I think that I can give you the best advice. There's a lot of confusion amongst lay people and some doctors who don't specialize in this, exactly what carpal tunnel is or isn't. For instance, you can have a pinched nerve in your neck that can look just like carpal tunnel, and it's our job to try and sift that out. And there are other reasons why people have numbness and tingling, like neuropathy from diabetes. And part of my expertise is being able to understand all of those and to see what's what.
Right. So this is something that it really benefits to go to someone like yourself who's a specialist in hand and wrist injuries versus just mentioning it to your primary care and someone who may not specialize in this.
Well, I think so. I think the primary care physicians do a good job, but I think it's also their role to understand as soon as you're dealing with something that's not in your area of expertise to get you to me, and then I can help you from there.
And is it easy to get seen? I know right now people are concerned about the pandemic. Would an appointment like this be virtual? Would you go in? Is it okay to come to the offices right now?
I think luckily in Connecticut, we're doing pretty well. So our offices are running pretty routinely with the protections that are being advocated for nationally and on our state level. So I don't think it's a hard call to get an appointment. And I do think that the personal interaction in my examination is key. I certainly have done this over the phone and can get the gist of it. But if we ever get talking about surgery, I absolutely want to talk to you in person and examine you in person.
Absolutely. And let's talk about just positioning your hands. Many of us are working from home a lot, or maybe you're in an office, but you're doing even extra work right now. So how do you position your hands the best way to minimize repetitive strain?
So it's if you imagine that you're looking at a classically trained pianist and you're looking at them from the side, they're going to be physically upright and erect. Their feet are going to be flat on the table. The top of their thighs on their legs are going to be parallel to the floor. And if you relax your shoulders, because we tend to hike up like this, if you relax your shoulders and just stick your hands out as if you're typing or on the piano, your wrists will be straight. So many of us are like this or like this.
Yeah.
You want it to be just straight. So if you imagine that piano player sitting, getting ready to do something beautiful for us, that's how you want to be. It's just human nature to slouch a little bit. So if you're at the keyboard all day long, you just have to have a mental reminder to stay straight.
Right. So it's not just how our arms are, it's that whole body. Do you recommend anything? I see sometimes people are sitting on those Bosu ball type things or putting pads right under the keyboard to support your wrist.
Yeah, I think everybody's life and journey through this is a little bit different. So some people will find those sitting helpers to be helpful. Some people do like to have something under their wrists. I think you have to kind of figure that out yourself and just take the advice that you see from various people to try and keep your wrist straight.
So a lot of people are doing more outdoor activities now that the weather has gotten warm. I know there's a bigger risk of injuries like sprains, strains, fractures. A lot of us worried about our kids out there playing ball in the yard and getting hurt. How do you protect yourself from that? Should you be using protective equipment? And what do you do if you think something happened?
Well, in that thought there, I think there's sort of two things. There's the kids playing ball and soccer. That's a classic thing where we see broken wrists with little kids. Frankly, I see more broken wrists in the sport of soccer than anything else, including football. So during the pandemic, no one was playing, but as people are getting out, you're starting to see that a little bit more. I don't think you can prevent a little kid or even an adult from hurting themselves. It's simply an accident. I think the advice is if you fall and you're hurting more than an hour or so, to me, it's worth getting an X-ray to prove that it is or isn't broken. And luckily, the sports fractures from kids playing soccer are usually pretty small and can be treated with a simple brace, just like the carpal tunnel brace that I showed you. For those of us who are venturing outside to do more things or return to sports and activities, a classic problem may be tennis elbow or lateral condylitis. And that generally comes from not using your arm and then really overusing it.
Okay.
I, for instance, got that diagnosis when I was helping my brother-in-law at the time tear down a house with a sledgehammer. And as a surgeon, I'm not used to swinging a sledgehammer. And I did that all weekend and got terrible pain in my elbow. Basically, the treatment is to wait it out. There's some controversy about injections, but there is some useful help using braces and just slowing it down.
Yeah, let me just let everyone know who's joining us. If they weren't here in the beginning, we're speaking with Dr. Andrew Nelson. He's with Starling Physicians. He's a hand surgeon, an expert in hand and wrist injuries. So we're getting the lowdown on that. I remember when I sprained my ankle, I was told by the doctor, rest, ice,
Ice,
compression, and
compression, and
elevate,
elevation.
right? Okay, so is that a real thing? Do we do that right away? Or how do you know if you need
Yeah.
heat or ice?
So I think that's exactly the thing to do when you hurt yourself. The elevation keeps the blood flow from causing it to swell more. The ice also cools and constricts the blood vessels and is also very soothing to an injured area. So it's basically telling you to slow down, put it up, and put a little ice on it.
You might do that at first, but then if, say, day 4 or 5, it's really not getting better, or day 3, when do you need to seek a doctor's care?
I'm a guy who always looks at patterns. So first of all, if you're just worried, go, because an x-ray and a quality exam can really answer the questions, and it may give you the comfort to do the next thing in your life or travel or whatever you're doing. So I'm a fan of early discussions and early x-rays because it will answer that question. If you feel that it's slowly getting better, you know that in your heart, then follow that. So if you're better tomorrow than you were today, that's good news. If you talk about your ankle, if you just can't walk on or bear weight, I do believe that's worth an evaluation. Most people think it's going to go away tomorrow,
Uh,
and then there's the next day, and then there's the next day. So I think that's where your question is. So if a couple days go by and you're still pretty limited, I really think it's helpful to get an expert opinion to answer the questions and hopefully give you a nice answer that nothing's broken and you can move forward as you need.
And as moms, we worried about our kids too, and sometimes you just want that extra assurance. I know at Starling Physicians, I've been to your facilities, and you've got a lot of locations, right? And there are some urgent care options, so people might be thinking, oh, I don't know if I can get in. Generally, you could be seen. What's the process?
Absolutely, yeah. My personal practice, I want to see people as quickly as I can. I realize that moms and everybody else, they're upset, they're concerned, they don't have the knowledge or understanding to know if this is really serious or not. And that's what my role is. My role is to take whatever's going on and help you feel comfortable and know that it's not as seriously, hopefully, as you thought it was. And I think that's really valuable when you sit down with somebody who's expert in their area.
And it might be worth it if you just mentioned a lot of soccer players and wrist injuries or something at home. Nobody really likes to go to the ER a lot. If you know who to go to, I mean, you could skip that and go straight to someone like yourself and get
Exactly.
a great answer and skip that whole ER process.
Right. I think things are changing in front of us over the last 5 years, and there are many people who just deal with it overnight and call us in the morning. And then luckily there are urgent care facilities, and there are many associated with the Hartford healthcare system in Starling. So you can get good answers, or at least temporary help, so that you don't feel left out to dry. And then you can talk to us as soon as we can get to you.
Now, that often happens with, injuries on the weekend with weekend warriors or maybe our kids playing, but also just people as you age, as you mentioned. There are a number of conditions that can affect our hands and wrists, elbows, just because we're getting a little older and we've overused things like arthritis and tendonitis. What can we do about that?
Well, there's a phrase in our business that motion is healing. So keep going is the good idea. What we tend to do is our brains are younger than our bodies, and we tend to overdo it. So it's kind of a little reflection if you're talking about running or walking or gardening or any activity, just to dial it down a little bit for your personal reality. But keep going is really the best medicine.
And there are some things that having regular pain in your wrist, there are actually certain diseases that people may not be aware of that it could be a sign that it's developed into that. Can you talk about that?
Sure. There's some classic things that go on. At the bottom of the thumb, which may be close to the wrist, it's a classic area of arthritis, especially for women. Sadly, women get it and men really don't get it. There's also something called, trying to see here, de Quervain's tendonitis, which is on the watch band side of the wrist, where you can get terrible swelling and pain, so it's hard to hold anything. And also there are ligament injuries from falls where you fall hard and actually ligaments tear, and there's a little bit more involvement with treatment there. Those are some classic things.
Now, I want to let people know if they're still on the Facebook Live. This is an opportunity that I will, in the next few seconds, I'll just wait to see if anyone has a question. I know people are watching, but maybe aren't sure if they just want to hear the information. If you have a question, I'll try and get that to the good doctor right now. But basically, I wanted people to know that Starling Physicians is local. Can you talk about your own practice and then just how easily accessible it is that you might want to use that as a first line of defense to get these answers?
So Starling Physicians has a nice orthopedic department where we handle everything from head to toe, spine surgery, joint surgery, sports, and feet. We're located at 1 Lake Street, and I think we're pretty accessible. Just make a phone call, and we're happy to get you in as soon as possible.
Great. So people can go to your website, which I'm going to put that up there right now in case people are wondering how they can reach you, Dr. Nelson, or get more help. You can go to starlingphysicians.com/hand, specifically, if you're really interested in what we're talking about here with all these hand and wrist injuries or carpal tunnel syndrome, tennis elbow. If you'd rather use the telephone, you can call 860-832-4666. And a lot of times, like you said, it might just be that you can help someone without surgery and you can prevent them from causing more damage.
Yeah, exactly. I consider myself very conservative. So my goal is to keep you away from surgery, and surgery is always a last resort, and it's done really as a team. I talk with you, and we come to a decision together. There are very few things that are absolute emergencies. There certainly are, but most of what we're talking about can be an ongoing discussion. And I think you're the most important part of the team as the patient. I'm the best person to be a teacher, but together we make those decisions.
Well, we want to thank you, Dr. Andrew Nelson from Starling Physicians, for taking the time and answering some questions about hand and wrist injuries. And for those who are watching and you think someone, a loved one or a friend might need this information, you can always share the feed. But doctor, thank you for being with us.
Thank you very much for having me.